I ended up connecting with the co-founders of Guava, who had also worked with me at Amazon, and they told me about this really cool project and startup that they were working on. I was like, oh my gosh, how do I join? Like, you are working on this really amazing thing that can help so many people. And you guys have such a great tech background, and I would love to be a part of it in any way that that looks like. So that's kind of how I ended up joining Guava. And a few months after that, it was early days Guava, and I was doing a lot of early interviews for people's personal experiences navigating the healthcare space, because really what Guava was at that point was we were building a foundation for solving an information problem. So we were building out integrations with the VA or Centers for Medicare and Medicaid, MyChart, Cerner, Epic, etc. And so one of the people that I chatted with was someone I had gone to high school with, Emily, who now works at Guava as well. And she had posted on social media about how she had chronic Lyme and 3 tick-borne illnesses and toxic mold poisoning, and how it was only through the fact that she had the accessibility and the funds to be able to go out of network for these providers that she was able to get a diagnosis. And that was a really impactful conversation, I would say, and kind of switched my thinking about what Guava could be. And so we really took that back to the team and said, hey, like, there's this absolute need in this chronic condition space of people who are spending 10 years to get a diagnosis and don't know where all of their records live. And so let's really try to focus on solving these really hard problems about integrating all this information into one place and see what we can build out to try to improve the quality of life for people who have these chronic conditions, whether they're diagnosed or trying to get a diagnosis.
Wow.
And allows you to track your symptoms and set med reminders and track your cycle and all of that information, because you are a whole person. It's not just the clinical data. It's not just the fitness data. It's not just the symptoms. It's like all of this packaged into one singular place. And then with that, you're able to, one, understand more about your own health, and then two, help your providers help you at the end of the day, because they have the information in a way that they can understand really quickly as well. And so that's kind of the core problem, I would say, that Guava is solving, because we've moved on a little bit from the foundations and we're able to kind of dive a little bit deeper into what we can do now that we have this data, so we can help you discover insights like, is air pressure actually affecting your headaches? Or is that, I don't know, spaghetti and meatballs that you eat every Friday impacting your stomach aches on Saturday morning? And so we've really kind of migrated into more of empowering the individual to get answers and to understand their health more.
Are there certain people or people with certain types of illnesses or conditions that the app is really well suited for? Does it make sense? Does it make sense for somebody who's really well to use it? I mean, maybe it's more of like preventive care, right? So I guess, I don't know, let's maybe talk through that a little bit.
Yeah. So Guava is ideally built for everyone. My parents who are in their 70s use it. I definitely will help them here and there with like what button to press, but they're capable and competent enough to be able to navigate the app pretty much on their own. And then we also have functionality and features for new parents for their kids. And so it really is a whole family experience. I would say that for right now, the people who find the most value, it seems like, just based on people reaching out to us, are people who are navigating the healthcare system a lot. And that usually means that they have more than one chronic condition, and they're seeing 5, 10, 15, 30 different providers within a 6-month period or a year period. And so they have a lot of information that is really challenging for them to keep track of. And they have all of these symptoms that they're experiencing. And when you're sitting in front of a provider and they're doing the rapid fire questions of how many headaches have you had this week, or what's the severity, or what's the frequency, and you get nervous and you black out, then you have to kind of repeat that exact same experience 5 times over to finally get an answer. And so Guava has really kind of bridged that communication gap for a lot of people, where that data just exists, and we've put it into a format that both a user like you and I can use And also provider can look at it and immediately understand the relevant information that can allow them to give the best care possible. And so they found that with Guava, the way that we're structuring the information for them, they have found conditions that they didn't even realize they had a diagnosis for. And it was diagnosed from a provider that they saw 5 years ago. And it was a diagnosis that they were actually spending a lot of money to get a diagnosis for currently. And that is not an uncommon thing that people have mentioned. Or they've talked about meds that they've tried and they can't remember the name. And so a provider will be like, oh, try this med, and it's something that they've already tried before. And so using Guava is actually a way for that information to be shared with their current providers because it exists in a siloed system that those providers don't currently have. There's clearly a breakdown of information sharing between the patient who thinks that they're doing a really great job of telling the provider what's wrong, and the provider is looking for very specific keywords. They're looking for things like dull, ache, burning, radiating when you're trying to describe your pain. And even though those are common words in our dictionary, it's not necessarily a common word for you to describe how you're feeling. And so the visit prep was created with that in mind to bridge that information gap of like, okay, here's the symptom that you're experiencing. With these default adjectives, how would you describe it? And what is the severity? And then if you've been logging for 2 weeks worth of time, you can create a visit prep and it's delivered in a way that is 1 to 2 pages long. And the providers really love that. It's been really amazing when people will email us or Instagram DM us or TikTok DM us and be like, hey, I used the visit prep experience, and for the first time ever, I actually feel validated by my provider and not just brushed off, or not just like, oh, you seem like a complicated case, I'm going to push you off to the next person. And that has been amazing to see because it does really it takes one good conversation with the provider to completely change the trajectory of someone's healthcare experience, right? Like that's all it takes. And I think that providers kind of forget that, and they sometimes feel like they are just another cog in the machine. And so being able to help facilitate a good conversation to make one person's life easier is really amazing for me personally. Something that's surprising, I would say, is we recently launched something called the Insights Hub. So it's a public page. You can go check it out, but it's where people are sharing their statistically significant correlations that they discovered through Guava. And so it's the, higher air pressure and increased headaches, or eating dairy and stomach aches. And so it's been really fun to see all of these different people sharing those stat sig correlations, and they can tag conditions that they have that they think might be related. And so I'll go on to the Ehlers-Danlos page, not the EDS page, the Ehlers-Danlos page, and scroll through and see what are common correlations that people are sharing within that group that seem to be patterns. And that's really exciting because, again, it's an under-researched condition. And so it's really putting power into patients or consumers or users to get answers or to find answers just through the power of the population and the power of the people.
This has been a Shut Up production.
Shut up!